Thank you, Mr. Chairman and Ranking Member Cassidy. Appreciate the testimony we've heard and your willingness to bring this to our attention in a very clear and convincing way. Obviously, the events that took place under Mr. De La Torre's management at Glenwood and other facilities across the country, including, by the way, 5 hospitals in Utah, was reprehensible and never should have happened. Steward was operating in my state from 2017 to 2023. They understaffed healthcare facilities. They didn't pay for required medical equipment. They failed to meet minimum operating standards. They refused to pay a number of vendors to the tune of about $40 million to vendors in my state. And most importantly, they endangered lives. And it's hard to calculate precisely how many lives have been seriously affected or worse as a result of their mismanagement. And clearly this kind of unusual setting warrants careful and thorough federal review. HHS at the federal level is responsible for conducting oversight to combat waste, fraud, and abuse. It appears that all 3 were involved at Steward. And I appreciate Chairman Sanders and Ranking Member Cassidy for bringing the issue before our committee. But I regret we don't have someone here from the administration, either this administration or the prior administration, to talk about, okay, what should HHS be doing? How can we oversee, particularly in the case of hospitals in rural areas, that this doesn't happen? And is there something that needs to be done at the federal level to make sure that levels of care are being provided? Is there something done at the state level? I'll turn to you, Representative, which is what happens at the state level? Is there some state oversight where state regulators lax in this regard? I don't know to what degree the federal regulators should have been taking more aggressive action, or whether they had the authorities necessary to do that. But from your perspective, is there something the state can do or should do or did not do that would have prevented either the tragedies in your state or perhaps in other states like mine that have been so gravely affected as well?
So at the time, and thank you for the question, Senator, the Undersecretary, the Secretary of LDH started investigating in November of 2023, which led us up to the hearing in spring of 2024. They do have, through the medical jeopardy process, the ability to suspend or terminate the license for the facility, and that's the path we were headed down with this particular situation. Some states are more aggressive than others. I mean, when you look at shutting down a hospital and the potentially hurting more people because of that, this is how both private equity and these facilities get away with these schemes, because they put your facility in jeopardy. They shut them down. Your community has nothing, so they suffer even more. So then they can come to politicians like you and me and ask for additional bailout money and other lifelines, which to me is part of the broader crime. So to answer your question, yes, there are pathways for our departments of health to hold them accountable, but the question is the pain worth more than the punishment?
And do you believe that additional federal oversight is important or necessary in this regard?
So I think more broadly, when you look at how these schemes are funded, they come through, and Senator Sanders mentioned Medical Properties Trust. When they're fueling this private equity movement to be able to fund these schemes, then yes, there's federal oversight, and it starts with the SEC. I'm shocked that a real estate investment trust can have such large ownership of a facility or a company like Steward. That's not how REITs function. Federal law should prohibit those things. So there's a broader conversation on how you fund it, and then there's maybe a less broad conversation around, specifically with the Department of Health and Hospitals, on regulatory environments that disallow these types of operations to exist.
Thank you. Mr. Chairman.